The United States government has been shut down for over 20 days now. While politicians argue in Washington, 46,000 American troops are working without paychecks. Over 10,000 federal workers have been laid off. The CDC lost a quarter of its workforce during flu season, and this crisis could become the longest government shutdown in American history. This isn't just politics. This is affecting real families, military readiness, and potentially your wallet. Let's break down what's really happening. Welcome back to StockScope Live. I'm your host, Ali, and today we're diving deep into 2025 government shutdown crisis that's dominating headlines and creating unprecedented chaos in Washington. While markets have been relatively calm so far this week, the economic impact is mounting daily. And if you're invested in defense contractors, healthcare stocks, or sector dependent on federal spending, you need to understand what's happening right now. This shutdown started on October 1st when Congress failed to pass a funding bill for the new fiscal year. We're now on day 21 with absolutely no resolution in sight. By the time you're watching this, it could even be longer. And unlike previous shutdowns that were mainly political theater, this one is different. It's being used as a tool to permanently reshape the federal government. So let's break this down into the key points you need to understand. First, let's talk about the military pay situation because this is generating massive headlines. You've probably seen 46,000 troops missing pay, quote, all over social media. Here's what's actually happening.
As I take a step aside here, there is quite a bit of military members and their families in line because of this government shutdown. We're in day 9 of it, and they're here for a food pantry. There's all sorts of food that is available, and I spoke with some military member spouses, and I spoke with some department heads here at the ASYMCA on why this is so important. What's the difference in the amount of people that you've seen from today to previously?
So when we first started coming, there definitely wasn't this amount of people. It was a lot, but it wasn't this amount to where it wrapped around the building. But lately it has been a lot. Like we were here last week and we were in line for like 2 hours.
In a normal week, we usually run out of food about 1 o'clock in the afternoon.
We've come a couple times before, but we haven't felt the actual need to come until the government shut down.
The Armed Services YMCA food pantry at Fort Hood was already familiar for Medaglia de Gregorio and her Army soldier husband. Now with a shutdown hanging over their heads, they face uncertainty deep enough to make them wonder about their future.
It's very stressful when us thinking about having kids and stuff like that, like if we're even going to be able to afford it.
When you're thinking about you might also lose a paycheck on top of already living paycheck to paycheck.
Pantry has been stocked up with food supplies, including vegetables, milk, eggs, and meat. But last week, the number of service members coming out to get some went up by an all-time record of 34%. All the food ran out by mid-morning, and this week, demand is expected to be higher still.
On October 15th, President Trump signed an executive order directing the Pentagon to pay active duty military personnel during the shutdown. That sounds great, right? Well, the problem is that this order doesn't cover everyone in uniform. There's about 46,000 full-time military members that are going without paychecks. They're called dual status technicians. They're full-time personnel in the National Guard and military reserves. They wear the same uniforms, follow the same military standards, perform the same duties like maintaining airplanes and fixing weapon systems, or providing technology support, handling administrative work for remote units. But here's the catch. They're classified as civilian employees of the Defense Department. Because of that civilian classification, they're not protected by the executive order. So if you visit a National Guard unit, you literally can't tell the difference between active duty personnel getting paid and dual status technicians working for free. And this pay disparity isn't new. This is just the latest example of how these technicians get treated differently. They don't get military health insurance until 2030. They don't even earn the same education benefit that were outlined in the post 9/11 GI Bill. They can't access VA disability treatment for injuries unless they happen during drill weekends. So we have 46K military personnel, people maintaining everything, just like regular personnel. They're working without pay while the government remains shut down. Many of these families are now facing impossible choices between paying rent, buying groceries, or keeping the lights on. Point number 2. Now, how is Trump paying these active duty military during a shutdown? This is where things get legally murky and constitutionally questionable. The administration redirected $6.5 billion from the Pentagon R&D Development Fund, money that was allocated but never spent. The total available was around $10 billion, and they used about $6.5. Here's the problem. There's a law called the Anti-Deficiency Act. This is like 150 years old. It explicitly prevents federal agencies from spending money that Congress hasn't appropriated. Violating this law isn't a slap on the wrist. Agency officials face up to 2 years in prison and up to $5,000 in fines. This law requires that the president obtain congressional approval before reallocating funds. Even the Republican Senator Jerry Moran from Kansas, who is also the senior member of the Senate Appropriation Committee, acknowledged the constitutional concerns. He said, and I quote, "Though the outcome is desirable, and we all agree it's desirable, there is a constitutional and legal process that requires Congress to not only be consulted, but involved," end quote. Trump's only legal justification was invoking Article 2 authority as commander-in-chief. But legal experts are calling BS, that this is unconstitutional expansion of the presidential power over appropriation, because Congress controls the purse strings. It's literally in the Constitution. Now we have Mike Johnson, the House Speaker, who's warned that this Pentagon solution is only temporary. Service members will miss their October 31st paycheck if the Dems don't agree to reopen the government. And whether you're on either side, I don't care. I'm just presenting the facts. The White House hasn't said whether they have additional accounts they can tap for future paychecks. Though some officials indicated Trump intended to keep finding money for military salaries throughout the shutdown. Now, what's hilarious is that the president being said here is very dangerous. Because if a president can unilaterally move billions of dollars around without congressional approval during a shutdown, then what's stopping future presidents, Democratic or Republican, from doing the same thing for any reason they choose? It's pretty dangerous. Point number 3. Let's talk about the mass layoffs, because this is where the shutdown stops being temporary and starts creating permanent damage. Several things. October 10th, over 4,100 federal workers received layoff notices across 7 agencies. The biggest hits came at the Department of Treasury at 1,446 employees and the Department of Health and Human Services about 1,100 employees. The White House budget director himself said that the total would reach about 10,000 layoffs. He explicitly stated that the goal is to be very aggressive where we can be in shuttering the bureaucracy, not just the funding, but the bureaucracy. This is unprecedented. Past presidents didn't use shutdowns to engage in mass firings. This is a historically anomalous tactic, using the funding lapse as cover to permanently reduce the federal workforce and eliminate programs the administration opposes. And the thing that worries a lot of people the most, even people outside of the U.S., is the CDC, because they got devastated. The union representing them said that an estimated 3,000 people, roughly a quarter of the entire workforce of the CDC, left this year through multiple ways, like these latest layoffs, earlier terminations of layoffs, and employees who took buyouts. Also on October 10th, alone, 1,300 CDC staff received termination notices. But then, due to an error, 700 of them later were reinstated. But the rest are gone. So that's about 300 plus 300, 600 employees. So the entire staff of the Morbidity and Mortality Weekly Report, which is a journal that provided health surveillance data for over a century, they're all gone. Okay. Other ones, like nearly all the employees at the National Center for Chronic Disease and Health, also gone. The CDC's entire Washington office that works with Congress, gone. The agency's ethics office, gone. Think about the timing. We're entering winter. Like, all the respiratory diseases come this season. And, we've seen it in COVID-19, where we're understaffed, and it led to increased hospitalizations and deaths. And we just gutted the nation's premier public health agency. So one of the directors that resigned recently, who was the director of the National Center for Immunizations and Respiratory Disease, said, and I quote, "The damage is irreparable. Weakening the CDC, even as a tactic to exert political pressure to resolve the government shutdown, leaves America less prepared for outbreaks and threats to infectious disease security." Because if you didn't know, this isn't just about government efficiency. This is about dismantling institutional knowledge and capacity that took decades to build. You can't just go out there and rehire these experts when the next pandemic hits. They'll be gone, man. They'll be working at the private sector or probably retired. They're like, F this, I'm out. So this is very severe damage to America's legacy. Point number 4, let's talk about numbers and economic impact, because this is how it affects directly your investments and your wallet. So about 750,000 federal employees are furloughed. According to this chart, there was a 620,000, but this is as of October 1st. The data I'm citing is from October 20th. So 750K out of about 2.184 million, that's about 40% of the total workforce. And so 750 are furloughed, and about just as many, 750, are working without pay, because they're considered essential employees. That's about $400 million per day in missed pay, according to the Congressional Budget Office. So what's the economic impact? Per day, it's about 0.1 to 0.2 basis points, not per day, per week, of GDP hit every week that government shut down. It's about $15 billion a week. So if this continues, it could reduce Q4 real GDP growth by up to 2.4%. And there's a lot of experts warning that this is going to be risky, because not just because of the shutdown, but because of the layoffs coming as part of the shutdown, which reduces consumer spending, which then trickles into other sectors and the economy itself. Because in 2019, the shutdown lasted 35 days, and the government cost about $38 billion in back pay for furloughed workers, plus about $2 billion in lost tax revenue. So about $5 billion. And that was with everyone eventually getting back pay. This time, they're saying that maybe there's a legal theory suggesting the 2019 law that's guaranteeing back pay doesn't actually guarantee it. But the funny thing is that this contradicts their own guidance from Trump 1.0. So this is impacting a lot of local communities, but where it really is hitting the most is where federal workers are concentrated, like in Alexandria, Virginia. City council member described the cascading impacts, quote, "Those folks can't pay rent, can't pay real estate tax, they can't go shopping. And that's hurting the commercial base in that area. You're talking about childcare, you're talking about restaurants, you're talking about they're just being able to go shop at Marshall's to buy a t-shirt," end quote. So some critical programs that are risks, like the WIC program, it serves about 6.8 million pregnant women, new mothers, and kids under 5. It's basically running out of money. And, while Trump said that he'd use tariff revenue to sustain it temporarily, it's about $22 million per day. That only covers it up to the end of October. So what's the political statement about stalemate? It comes down to healthcare subsidies. Enhanced Affordable Care Act premium tax credits. They are set to expire at the end of this year. Those subsidies help about 21.4 million Americans afford healthcare insurance. But without them, the Congressional Budget Office, the CBO, projects that 3.8 million people would lose coverage, and the premiums for the ones that are staying would more than double. So it will become almost unimaginable for those families, because now they have to choose between healthcare or groceries. So the Democrats are demanding these subsidies be extended as a condition for any future funding bills. While the Republicans control both chambers, they need 60 votes in the Senate. So that gives the Democrats some leverage. The Republicans refuse to negotiate until the Democrats approve the House-passed continuing resolution. The Senate Democrats rejected the Republican bill 11 times as of October 20th. But This is where it's funny. Sad, but funny. Trump has shown little urgency to resolve this. He's gone as far as booking an Asia tour, a multi-nation Asia tour starting October 26th, which could prolong the shutdown even further. And he is trying to reshape the bureaucracy, eliminate programs, and pressure the Democratic areas by suspending federal projects. So let's talk about polling for a second. Polling shows about 60% of Americans blame Trump and congressional Republicans, while 54% also blame congressional Democrats. Everyone's getting blamed, but no one is budging, and real people are the ones paying the price. Thank you for watching to this point in the video. This is where we're going to talk about what this means for your investment. So there's a few things to watch out for. Number one, defense contractors could see volatility. The Pentagon redirecting R&D funds means delayed projects and contracts. Companies dependent on those research programs could see revenues pushed into future quarters. Number two, healthcare stocks tied to ACA subsidies and Medicaid are something you need to focus on. Because if the subsidies expire without extension, insurers could face massive enrollment drops. United Health, Centena, Molina Healthcare, watch these carefully if you have investments with them. Number three, federal contractors across the board face the payment delays and project suspensions. Companies like Booz Allen Hamilton, Leidos, CACI International that derive significant revenue from government contracts could see Q4 and even maybe Q1 earnings impacted. And number four, consumer spending could weaken if the shutdown extends, because we talked about 750,000 furloughed workers plus another 750 working without pay. That's a massive loss in purchasing power, particularly in regions with high federal employee concentrations like in Virginia. The longer this goes, the more it weighs on GDP growth, on consumer confidence, and on economic momentum heading into 2026. As of this recording, October 21st, we're on day 21 of the shutdown. This makes it the second longest in U.S. history. And funny enough, the longest is 35 days from Trump 1.0. I'm seeing a pattern here. If we hit November 5th without a resolution, that would make this number one and Trump 1.0 number two. Just kind of funny. So anyway, if you found this breakdown valuable, smash the like button and please subscribe to the channel. We're going to provide any type of analysis that impacts your investments. Drop a comment below. I'd love to hear, do you think Congress should pass a law guaranteeing military pay during all future shutdowns? Let's discuss this in the comments below. The shutdown creating a real consequence for military families, for federal workers, public health capacity, and the broader economy. Unlike past shutdowns that eventually resolve with everyone getting back pay and things returning to normal, this one is being used to permanently reshape the federal government. Whether you agree with that approach or not, the impacts are real and they're lasting. Until next time, stay informed, stay diversified, stay safe, and I'll catch you in the next video.